Knock, knock. Hello. Hi. It's nice to meet you. I'm Dr. Abby, and I'll be doing your cranial nerve exam today. Could I just confirm your full name before we start? Okay, thank you. So I do have the right patient and your date of birth. Lovely, okay. So we're just gonna hop right into it. You've had a cranial nerve exam before? Good. Okay, so you know what to expect. I won't do too much explaining. Okay. Let me just sanitize my hands. And how are you feeling today? Doing okay? Alright, good. Are you having any problems with your cranial nerves at all? Okay, yeah, we'll make sure that we do a thorough check. Alright. When was the last time you had your vision checked? Alright. Okay. Good to know. And can you see me clearly? And can you hear me okay? Alright, good. I assume so since you're answering my questions. Okay. Any pain or discomfort anywhere in your head, down your body? Any numbness, tingling? The bad kind of tingling? Okay, alright, good. We're gonna start with your eyes, so if you just look straight ahead, okay? It's gonna take an initial look and then I'll get you to follow some instructions. Okay, so just look at me. Okay, any dryness, redness, sensitivity to the light at all? Okay, good. Now if you could keep your head still as best as you can and follow the light. I'm gonna go this way, in a circle. Good. We're gonna go up and down. Good. And side to side like this. Okay. Any double vision? Alright. Now if you could look at the light. I'm gonna start out here and then bring it closer to your nose. Keep looking at the light. Testing your convergence, depth. Okay, very good. Same thing, look at the light over here. Follow it in to your nose. Excellent. Alright, let's let your eyes adjust for a moment. I'm going to check your pupils. Okay, let's do one eye at a time here. Okay, just look straight ahead at me. Dilating normally. Excellent. Okay, blink if you need to. Let's do the other side. Good. 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 Alright, good. Did you go blurry there for a moment? Okay. Let's do the direct and consensual response. So, just hold still, look straight ahead. Direct. Consensual response looks very good. Just bear with me. And direct over here. Direct. And checking the other side. Consensual response. Okay, look straight at my nose if you can. You okay? Alright. Shine the light. I'm gonna pull around on your eyelids a little bit. Is that okay? Alright, just pulling down here. And can you look up for me? Alright, and pulling on the upper eyelid. Look down. Look down. Look down. Okay, other eye, just pulling down here. Can you look up? Look up, look up, look up. Color looks good. And now look down. Excellent, very good. Okay, let's give your eyes a little break. Perfect. So, testing your vision now. Can you see the charts? Yes? Alright, with both eyes open, can you just tell me the letter that I'm pointing to? I'm just gonna grab my pen here. Okay, ready? This one? Good. This one? Mm-hmm. This one? This one? Can you see that one there? And can you read that line for me? Good. Mm-hmm. Perfect. Good. Great. Can you read the line below that? Good. Okay. Good. Mm-hmm. Okay. Can you cover up one side, whichever side you prefer? And can you read the fourth line for me? Good. 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 Cover up the other eye. Can you read the fifth line backwards? Good. 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 Okay. Good. Okay. And what is this color right here? And this one? Excellent. Let's do a few more color tests. I'm going to flash a pen in your vision, a colored pen. Can you just tell me what color you see? Mm-hmm. What color is that? Good. 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 Yeah, let me grab a few more in my hands here. Like an octopus here. What color is that? Or what color is this? Good. Good, good. And now I just have a couple questions for you. What color or what color family are these two? Okay, what's the difference between them? Okay, this one's more of a blue and this one's more of a green. Perfect. And what about these two? What color family? Pink. And the difference between these two? This one's a little bit darker, lighter. Good. And let's do these two. Last one here. What color family? Yeah, blue again. And the difference between them. Okay. Now can you choose two colors out of all of these? Doesn't matter. But, okay, purple and turquoise. Very good choices. Can you follow the purple pen only? I'm just going to test your focus ability. Just look only at the purple, okay? Can you now look at the turquoise? My childhood bedroom was this color back in 2012 or so. It briefly. Okay. And do you have any problems with peripheral vision? Okay, let's check. So if you could look at my nose, I'm just gonna hold up some fingers. Tell me how many fingers I'm holding up. Ready? Good. 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 Perfect. Good. 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 And which what number is closer to you? Excellent. And now. Good. And now. Okay. And now. And now. Excellent. Okay, keep looking at my nose and just tell me when my fingers enter and then leave your vision. I'm just gonna wiggle them. Okay. Good. 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 Okay. And now from which direction is my finger coming in? Good. And here. Great. And now. Good. And now. Good. And here. Great. Okay. Eyes look totally, completely fine to me. So I think we can move on to check your hearing now. Now, before I do any hearing tests, I just want to have a brief look inside your ears. Is that okay? Alright, perfect. So I'm just gonna grab my little tool here and just take a look. You can just keep your head still. I'll check this side first. Alright, so just coming on the side here. Take a look. This ear. Do you clean your ears at all regularly? Okay, and how do you clean your ears? Alright, good. Good, everything looks clear and healthy. And pulling up and back, checking inside the ear. Very good. Excellent. I'm just going to check the other side. Okay. Now checking this ear over here. Oh wow, this one looks even more clear than the other one. Congratulations. Okay, just pulling up and back. Very good. Everything looks healthy on this side too. No redness, signs of infection. Very, very good. Okay. And if I just gently feel, just pinching on the earlobes. Any pain there? Okay. Any pain on the back behind the ears at all? Any pain behind the ears? Okay. Okay, great. Now close your eyes for me and just tell me right or left on which side you hear my gloves. Good. 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 close or far away from your ears? Keep your eyes closed. Very good. 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 Okay. Now, is it alright if I come a bit closer and whisper some numbers into your ears? I just want you to repeat them back to me, okay? Alright. 6, 9, 7, 2. Good. 8, 7, 2, 1. Please ignore the curtain in the back. We're still working on getting an actual curtain rod. 8, 4, 6, 10. 5, 9, 7, 2. Perfect. Okay. Now we're just gonna do some directional sounds. Tell me if the sound is in front of you, behind you, to the left, or to the right. Perfect. Okay. Would you like to do a tuning test? A tuning fork test? Yeah, why not? Okay. Let's do it. So, just tell me when the vibration stops with this tuning fork, okay? It's a bit of a newer tool, so let's see how we do. Ready? Let's try again. Okay, one more time. Fantastic, you passed. Okay, great. We're gonna move on to your nose. Do you have any problems identifying scents? Okay. Right. And any congestion, stuffiness, sinus pressure? Okay. Do you mind if I take a quick peek up your nose before I give you some scents? Okay. So if you just tilt your head back for me. Take a little look here. Okay, making sure that there's no blockages. Everything looks pretty clear there. Okay, good. And the other side, just one moment. Taking a look. Taking a look up your nose. Taking a look up your nose. Taking a look up your nose. Okay, very good. And can you focus on me? Can you breathe in, hold one side, and take a breath in? Good. And the other side? Okay, all clear. Good. Now I have some scents for you. If you could close your eyes, no peeking. Tell me what you smell here. These will all be pleasant, so don't worry. And one more. Yes. That one's good. That one is vanilla. Well done. Okay. So, nose is fine. Do you mind if I just press around? Just check for any sinus pressure. Okay, just hold still. I'm just gonna feel the sides of the nose here. Gently under the eyes. I'm just gonna press right the eye socket of the forehead in the center. Any pain or pressure in the temples? Oh, it feels okay. Alright, while I'm here, I'm just going to feel your glands before we move on to your mouth exam. Feel your lymph nodes. A slight swelling. Have you been sick at all recently? Okay, 3 weeks ago. I can feel that's lingering, but yeah, you seem pretty energized, so I'm glad that's over for you. Alright, so can you open your mouth? I'm gonna take a look if that's alright. Just grab my little stick here. Alright, just open up and say ah. Looking at the back of the throat, which doesn't look too sore or beautiful. Okay, and just checking the tongue color looks good. No mouth sores, infections, or ulcers or anything. Teeth look nice and healthy. Okay, and can you stick your tongue out? Yep. Can you move it to the side? Good. Can you move it to the other side? Good. And can you stick your tongue up and down? Okay, excellent. How about we do some taste tests? Taste tests. Okay. So, I also assure you this is a pleasant taste. Okay, just stick your tongue out again. Just going to apply a little flavor drop. And what does that taste like? Raspberry. Well done. And a quick spray. Okay, open up. Just gonna spray this on your tongue. What does that taste like? Mint. Perfect. Well done. Okay, and I'm just gonna feel down your throat and your neck. Checking your thyroid. And just holding right here. Can you swallow for me? Very good. Okay, I'm just feeling collarbone area. The side of your neck. Under your chin, just tilt your head up a little bit. Okay. Lips look very well hydrated, not too dry. Now I'm just gonna have a look at your skin and do a little bit of a face exam now. do a quick skin inspection. Do you have any problems with your skin at all? Any problems with acne, dryness? Okay. Yeah, I see. It's a little red underneath your nose, probably from your cold when you were blowing your nose. I see that, but it doesn't look too bad. Looking also for any strange spots, rashes, moles, anything you might not be able to see. Okay, the skin looks very well hydrated. Perfect. Okay. If you could close your eyes for me, I'm going to brush your face with a soft fan brush. Just tell me when you feel it. Good. Good. Mm-hmm. Good. Good. Excellent. Perfect. Okay. Now I'm going to use the pointy side. This will be sharp and this will be soft. Just tell me, sharp or soft? Soft. Sharp. Soft. Sharp. Sharp. Soft. Soft. Sharp. Excellent. All of your sensations are normal. Now I'm going to get you to do some funny faces, okay? Can you raise your eyebrows for me? And don't let me push them down. Excellent. Can you close your eyes really tight? Good, really tight. Don't let me open them. 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 Perfect. Can you puff your cheeks out? Very good. And keep it like that. Don't let me push the air out. Excellent. Can you open your mouth? And don't let me close it. Good. And now keep your mouth closed and don't let me open it. Good. Can you frown for me? Can you smile? Show me your teeth. Good. Can you turn your head into my hand and resist? Good. And the other side, resist. And from the top, just turn your head up into my hand and resist. And from the bottom. Okay, and now lean forwards and press your forehead into my hand, resist. Excellent. Okay, can you shrug your shoulders up and don't let me push them down? Very good. And can you tilt your head to one side and stretch your neck out a little bit? And the other side. Any pain? Any tenderness? Alright. Perfect. I'm just going to take a couple of facial measurements, if that's okay with you. Just for science. Yes. Okay, just give me a relaxed expression. You can take a break while I do this. Good. Good. right here. Keep it relaxed. I'm just gonna tap around. Okay. Good. Very nice. Good. And on your wrist. Good. Good. Very nice. And the other side. Good. Almost lunchtime. Good. Good. And on your wrist. Good. Good. Excellent. Okay. And I'm just going to percuss a little bit on your chest. Okay, just relax. Good. Good. Okay. Good. Okay. 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 Good. Okay. Okay. Excellent. Alright. Can you hold your hands out like this? Good. I'm just gonna press against them. Try to resist, okay? Good. And now don't let me pull them. Good. Keep your fingers spread. Don't let me close them. Good. Good. Okay. Can you take one hand and then take the other hand and flip-flop your hand like this? And the other side. Excellent. Okay. Everything looks very healthy. I'm sad we're at the end of the exam now. We're gonna have to say goodbye. But everything looks totally normal, perfect condition. So that's great. You get an A+ from me. Well, even if there was something wrong, you would still get an A+, but you know what I mean. Okay, so just write that up. Do you have any remaining questions or concerns? Anything at all? I wish we could spend more time together too. But I have my next appointment coming in soon. Okay. Just writing that up. Feel free to come back anytime you have a concern, okay? Alright, but with your perfect state of health, I don't expect that to be too often, but okay. Alright, so it was a pleasure to see you today, and I wish you a great rest of your day. Feel free to gather your things and head out when you're ready. Alright, take care.